Do you frequently feel like your heart is racing or your muscles are screaming when you start exercising, like walking upstairs or carrying groceries? But then it gets better if you slow down. Imagine trying to run, and suddenly your legs feel like bricks. That's something people with glycogen storage disease type 5, also known as McArdle disease, deal with. It's rare but real. Your muscles can't use stored energy the right way. And that causes pain and weakness during activity. Think of it like a phone that has battery, but the app to use it is broken. Your body has fuel, glycogen, but it can't turn it into usable energy in muscles during early movement. So why does this happen? It's because of a broken muscle key, a protein called myophosphorylase. This key normally unlocks glycogen, your body's stored sugar, to turn it into energy when you move. But in McArdle disease, that key is missing or not working. And it's all due to a typo in your DNA, inherited from your parents. If both your mom and dad passed you a faulty copy of the PYGM gene, the body can't make the key. It's like getting a car from both parents, but neither gave you the ignition key. No start, even with fuel. This only happens when both parents carry the broken gene, even if they don't have symptoms themselves. You start walking your dog. After 5 minutes, your legs cramp up painfully, like a Charlie horse. You stop, you rest. Then you start walking again, and it feels better. That's the second wind phenomenon, a clue doctors look for. Other signs: muscle stiffness, feeling weak fast, sometimes even dark urine after exercise, from muscle breakdown. Kids might avoid gym class, not because they're lazy, but because running hurts. Imagine being told to push through when your muscles are literally running on empty. Fatigue, soreness, and anxiety around physical activity are real parts of life for someone with McArdle. How do doctors figure this out? First, they might ask, do you get a second wind? That's a big hint. Then, they can do a simple blood test after a short exercise to check for lack of lactate rise, because without the key, no lactate is made. A muscle biopsy used to be common. A small piece of muscle is removed and checked for the missing protein. Today, a simple genetic test can confirm it. Treatment, no cure yet, but smart strategies help. Eating a snack with complex carbs before exercise gives immediate fuel. Some drink a sports drink with sucrose, table sugar, during exercise. It's like adding a shortcut fuel line. Regular light aerobic exercise, like walking, helps train the body to use other energy sources. Rest is not quitting, it's part of the plan. Can we prevent McArdle disease? No, not once you're born with it. It's in your genes. But we can prevent passing it on. Think of it like a secret family recipe that happens to be broken. If you and your partner both carry the faulty PYGM gene, you can talk to a genetic counselor. They help you understand the odds, like a 25% chance for each child to have the disease. Some couples choose IVF with genetic testing to avoid passing it on. While we can't prevent the disease in someone already born with it, we can help prevent complications, like kidney damage from dark urine, by staying hydrated and avoiding overexertion. There's hope on the horizon. Scientists are exploring gene therapy. Imagine fixing the broken PYGM gene in muscles so they make the key again. It's been done in mice, and early human trials are being planned. Other studies test new energy-boosting drinks, like using maple syrup. Yes, really, because its sugar, fructose, may help muscles make energy a different way. Wearable tech is helping track safe exercise levels. And more doctors are learning about the second wind sign, so people don't go years misdiagnosed as anxious or lazy. Research is small but growing, and patients are part of it, sharing their stories to speed progress.